Hey class, I'm going to make a video. The weather is potentially bad tonight. So if it gets worse, I'd like to have this recording. So basically, I'm on Blackboard and I want to talk about a few housekeeping items. We posted on here that there was some confusion about the pre-lecture quizzes. I did give you full credit last week, but starting this week, I need the pre-lecture quizzes for you to get those participation points. Again, if you miss one, it's only going to be a point or two, so don't stress about it. And in the announcements, I have this video. You can go back and watch it on how to do
My Evolve.
the pre-lecture quizzes.
In My Evolve, you should have all your textbooks.
So for every chapter, you should have the 5-question pre-lecture quiz.
How to get that.
And so this video will tell you how to do all that.
So when you get an assignment to read, you're going to click on your resources. You're going to click
So if you need to review this video, do that. And you're going to do the questions at the end of each chapter. So like for this week, I asked for both chapters. Chapters 45 and 46. This is not to, be cruel. It's to try to get you to read. It's try to get you to understand the material. Okay? So, in the event we don't have class tonight, I will still take my handy dandy little clipboard and I will mark if I get this from you guys or not. I'll also be putting a few exercises in this lecture, within this lecture, and if you complete it, then you will also get participation for that. I need to know how many people think that they could come on a Wednesday night, sometime in April, around 3 o'clock. We're trying to get a guest speaker, and it's about dementia, and we'd like to know how many, a raise of hands of how many people could come. So be thinking about that, and if we don't have class tonight, we'll get a raise of hands on Monday. Monday, we will have a test review with Miss Kathy. She should have a study guide, because next Wednesday, you will have your exams. Let's just look at that real quick. This is supposedly tonight. Hopefully we meet. Here's your assignments that are due, and she will review this night, and your test is also going to be on Wednesday. Now, I won't be here Wednesday. She will be doing lecture this night, and then I'm doing lecture on the 3rd and the 5th. We've got some exciting chapters. Don't forget, tomorrow will be our first clinical day. If there's a problem with the weather, we will contact you. But from 9 to 3, we are meeting here for school nurse training. Be in your scrubs. They are the slate gray scrubs. So check your handbook with all the instructions on participation. This is a clinical day. So we get clinical hours for that. Speaking of clinical hours, I didn't have my computer last week, so I'm going to navigate one other place, and that is the clinical folder. For you guys that have done home health, you may have already been in here. When you finish your experience, your home health experience, you're going to go in here. It tells you where to go and what time, and then it has a little guided reflection for you to complete. We will have name tags tonight. If there's no class, we will get name tags for you on Thursday. So there's also a spot here for professional maintenance. There's a place for VSIMs, case studies, and we even have one for tomorrow, school nursing. Okay, so let's get back on track for tonight. I did want to review last week a little bit. We talked, remember, about the nursing process. The nursing process is still something we use, but it's kind of outdated, believe it or not. Let me get my folder out here. If you remember last week, the nursing process is kind of the old way of doing things, but we haven't completely gone away with it, so it's still there. For the paramedics, nursing process. Remember, that is assessing diagnosing, implementation, and evaluating. It's the old way of doing care plans, nursing care plans. There's nothing wrong with it, but as nurses we don't really diagnose. So instead of having that, they went to Tanner's, the Tanner's model, which is clinical judgment. And remember, it kind of flows with the nursing process. But instead of assessment, you have noticing or cues, and then you have interpretation, which you think it might be, what's leading you to the problem, like alteration of perfusion or something of that nature. And then how you respond takes place of implementation. And under responding is where you can do a skill, you can delegate, you can decide what the nursing priority is, and that is also based on your ABCs and Maslow's hierarchy of needs. Backing up a little bit to delegating, remember the back of your NCLEX RN, you need to look at the 5 rights of delegating. You would never delegate an assessment or a clinical judgment, and you need to kind of know what you can and cannot delegate to a unlicensed personnel. Also in the same responding is teaching, and as RNs we do a lot of teaching. And then you have reflection, and that's kind of the evaluation portion, following up if someone had a medication, see how they responded to it. It's also where you collaborate and you find out if what you did was good or bad, sort of the feedback is, and you get a deeper meaning of what you did. And then also in the lecture they talked about beginners, novice to expert, and that's kind of where this falls in. You know, having critical thinking skills takes time, and it's something that experience makes you better. Okay, so hopefully y'all got all that. Everyone did pretty good on the post-lecture quiz. I think really number 1 was the one that people missed the most. Okay. I'll put that back in here so I don't misplace it. All right. Now, I'm not very excited to do it this way because I had so many plans. So hopefully we'll have class tonight, okay? If the weather's bad and you can't get here, you won't be punished. You'll just have this boring lecture to listen to. Okay. Here are your handouts. Of course, I can't give you one physically. If you need one, we can print them tomorrow or next week. So just let us know if we can help you with that. We're going to start with communication. Okay, communication. Sorry I don't look at the camera because it's way up here. So I typically look straight ahead. It's my fault with my little camera here. I'm sure y'all want to look at me anyway. Okay, so we are going to go over defining the concept of communication, the scope of communication, identify attributes, and apply effective communication skills. Communication is really important in nursing. I know a lot of you think this is kind of basic, but it's really not. I mean, to communicate effectively is really important, not only in nursing, but in everyday life. And you will find the better you communicate, the better your job will go and life will go. So communication is a process of an interaction between usually 2 or more people. It's to exchange and interpret messages about ideas, emotions, and mind states. So of course we're not going to be doing this collaborating and learning, unfortunately, but I kind of wanted to know the difference between spoken and written communications can be misunderstood. And as you know, communication is not always verbal. It can be nonverbal, expressive, facial expressions, body movement. Written is a little different because a lot of us will use medical abbreviations. will spell things wrong, and that is why we came up with technology, and technology has really helped us decrease errors. Most charting now is going to be done on an electronic device, a computer. It's going to be typically a chart by exception, and what that means is you will get a screen, and if you don't click anything, especially on the physical exam or the history, then everything's normal. You only are going to click if something is abnormal, and then you'll have a little drop down text box where you have to maybe type something in. But now it's typically that way because it helps lower errors. If you're like me, I still love to write out my H&Ps, but then again, I do abbreviate a lot, and if someone was reading one of my notes, they may not know exactly what I was talking about. Okay, so there's 3 categories of communication. This is kind of basic, but it's okay. The first one is spoken or written. The well, forget it, I can't say it. It is nonverbal. Okay, this is going to be eye contact, gestures, facial expressions, and the last one is just the context of the message. Let's see this couple picture. So you guys have been and this is one of the things we were going to do in class, and we may still do it, is, you know, when someone comes to talk to you, or you go to talk to a patient, let's always keep it on medical terms, the way that patient responds to you is depending on your affect. It depends on your body language. It depends on your facial expressions. If you go in there all mad and you just don't have time, and Miss Smith, how are you today? You know, she's not going to respond. But if you go in and sit by her bedside and hold her hand and smile and use eye contact, you're going to get a better response from that patient. So this was another group collaboration. We were going to get together and discuss ways and examples you can enhance communication, and then ways that you can hinder communication. So kind of think about that. Okay, so I've got my own discussion on this. I'm not really crazy about these slides. I think I'll just go to this one. And you probably know from kind of way back when you were younger on how to communicate, hopefully, maybe not. Your message is from the sender, right? That's your message, your transmission. And then the person that decodes it is the receiver, okay? So that's what this basically is saying. There's an exchange. You've got someone who is sending the information or the message, and then you have someone who's receiving it or decoding the message. I always think of that old game we play as kids where you tell somebody something at this end, and by the time it got to the other end, it was always a mess, right? So there's many factors that can mess up a exchange. Off a little bit, I apologize. So this is the quality derived by the participant. Again, it's your environment, it's a relationship, it's your mood. Mental and physical conditions can cause problems with this. Experience, education, noise, and culture. There are a lot of cultures that communicate differently. The one I like to give an example of is Hispanic mothers with children. As a nurse practitioner, if you're seeing their patient, even as an RN, they want you to recognize the mother first and talk to the mother first before you, kind of like getting permission before you assess or touch the child. So this is a hierarchy of relationships. It's just kind of talking about how, again, it's that telephone, how you always affect the communication at the lower and higher level. And this is an important thing to remember. And a good place to refer to in your reading is Think Like a Nurse, okay? If you will go to page 140, it talks about things to assess when communicating with a patient. So we don't think about patient's education level. Typically, most older people, they're called the, I can't remember what that class of people are called. It'll come to me. But the ones that are 65 and older, some of them only have an 8th grade education. Baby boomers, sorry. Culture, like we talked about, maybe English is a second language. Cognitive condition, if they're in with a head injury, they're not going to be able to discuss things with you as easily. And then, of course, anxiety. And so this book goes through all that. It has a cool little activity tool that even includes generational differences, barriers to learning, things of that nature. So you got to think about that when you're caring for a patient. Things we don't really think about, right? It's a learned skill, okay? I feel like I communicate with patients pretty well. Not trying to brag, but I have learned that skill. I talk monotone, I talk slow, and I make sure I talk to the patient. Remember, you got hard of hearing is really difficult too. So, competence includes being effective, appropriate. Okay, a good thing to do with patients is to teach back. Why is that important? Because you're telling them something and you're asking them to repeat it to you. And you will do this a lot in nursing and in your NCLEX. You will have questions where you have to validate what they're asking or kind of reiterate what they're asking. And that's a really big part of therapeutic communication. So we're not going to do this group work, so I'll give you an example. So you have a client who's scheduled for an angioplasty, and he says to you, I am really afraid of this procedure, and I'm afraid I'll be worse afterwards. So what would be your therapeutic response? So think about that, What are you going to tell this patient? Are you going to tell him everything's going to be okay? Okay? Are you going to say, try not to worry about it? Okay? Or tell me what you understand about the procedure. Okay, so that's the answer, because you don't want to give them false reassurance and you don't want them to diminish their worry. You want to actually ask them what they're worried about. Okay, so that's a good example, and we'll get some more examples here in a minute of therapeutic communication. Okay, this is a cool slide. This is more, I give this more my technology discussion, but I'm glad they put it in here, so I'll talk about it. So there was a big paper written, and it's called To Err is Human, and this is basically what started healthcare quality and patient safety. And this is what started computerized orders. It's what started the computer on wheels for medication administration, because they found there was an estimated 100,000 medical errors each year leading to injury or death. From communication errors, medical errors. But a medical error can be considered communication, right? So that's what this all started. And part of communication technique was the S-bar. Okay, so we're going to talk a little bit about S-bar. Okay, I'm going to pause for a minute. If you want to take a quick break, I'll be right back. Okay, so communication in the work environment. Okay, this is really important. The team strategies and tools for enhanced performance and patient safety was developed, and they developed principles for communication. And we all went over this about how poor communication can lead to medical errors. I'm just going to kind of scroll through here. When you communicate with a patient, you want to be honest. You don't want to be too simple. You don't want to be too complex. You don't want to use medical jargon. You want privacy, okay? So maybe shut their door and talk to them. You may have to get a interpreter, okay? So Team Steps is a strategy to enhance patient safety. And it's developed methods and tools to deliver communication in an interdisciplinary manner between team members, especially during change of shift. Okay? So feedback is really always important for team performance, like a reflection. We'll come back to this one. So we want to go to the S bar, okay? Changes in condition. Situation is what the S stands for, background is the B, assessment is the A, and recommendation is the R. Now, if you read your chapter, you'll see that they also talked about, and they added some other parts to the S bar. Listen, medicine and nursing always is changing, so it never stays the same. And it starts with an I, identify self, is what they put before the S. So before you call a physician or report a change in condition, you want to follow these steps. Have I assessed the patient? Because that's really important. If you don't assess the patient, that doctor's going to ask you questions you do not know the answer to. Has it been discussed before? Have you reviewed the chart? Do you know the diagnosis and the date of admission? And have you read the most recent progress notes? You're going to need the patient's chart. You're going to need the list of meds. Probably have the computer on wheels near you. You're going to need your vital signs, their code status, and any lab that was drawn that day. Okay, so situation, and in the new terminology, they put an I here for identify yourself, patient, room number, state the problem, your background. You're going to need the admitting diagnosis, the date of admission, current meds, allergies, fluids, labs, vital signs, lab, code status. This assessment is the situation. So a perfect easy one is your patient starts having chest pain, okay? And what's your recommendation, okay? Maybe you don't have an order for an EKG. Maybe you don't have an order for morphine. So those are the things you're wanting to recommend. Or maybe you want to consult the cardiologist. And then after reporting, you want to document, okay? So we also practice with this in this program as a checkout too. So if you're coming off shift and someone else is coming on shift, this is a great way to give a little synopsis of the patient. So again, change of shift, face to face. You can use that same S bar. Okay, so I want to go back real quick. Other ways we use better communication and technology are your computerized physician order entry. The physicians have to do this themselves, the nurses cannot, and it has helped, again, decrease errors and decrease that barrier of communication. Old way of doing it, a doctor would call and give a page full of orders, and if that poor nurse forgot an order, she was written up. Now it's the doctor's responsibility, and that's really how it should be. They have to sign the order. If they do communicate to the nurse, then it can be done that way, but like at Baxter, it can't. My husband cannot call in an order. He has Cerner at home, and he has to go in and actually type in his orders. Okay.
Hello, I'm Andy Lohr, Vice President of Nursing Operations here at Children's of Alabama. As you know, safety is one of our top priorities here. Evidence-based practices show bedside shift report is the safest delivery method for handoff reports. In this video, we want to show you some demonstrations of bedside shift reports. First are some examples that don't promote safety, but may be practiced in your area. Watch closely.
Cindy and Abby. I'm going home. I'm going to give a report to your next nurse, Al, okay?
Sounds great.
Okay.
Hey, I'm Al. I'm going to be your nurse for the day.
Hey, Al.
Okay. So this is Miss Sydney Smith. She had a pretty good night last night. She's still on the liter of oxygen and maintenance fluids, but overall, she's good. I think that's about it.
All right. We're done. I'll be back in a little bit. Give me some knuckle. Awesome.
Bye. Bye.
So, do you want to go check and see how bedside shift report is going?
Yeah, that's a great idea.
So, how was your night?
Oh, it was awesome. We went to this new place on Southside last night. It was fantastic.
I can't wait to hear about it. Do you want me to give a report on the 3 patients you had last night, or you're good?
No, just the highlights and any changes maybe.
No changes. They're all great.
Awesome.
Mm-hmm.
Hey, guys. How's bedside shift report
Hey,
going?
we're just about to head in there.
Yeah, we're going.
Awesome.
All right.
As you just saw, the nurses were not involving the patient or family or referring to the EMR during handoff. Data collection shows that we have room for improvement in handoff of care reports to promote a safer environment at Children's. Now let's see how to educate parents and promote their involvement with bedside shift report. Notice how the nurse handles the parent's initial resistance and how the off-going nurse helps prepare the family for bedside shift report prior to the shift ending.
Hey, how are you guys?
We're good.
I'm Taylor. I'm going to be your nurse today. You're Miss Abby?
Uh-huh.
And you're Sydney? Okay, well, I just want to discuss a little bit about our bedside shift report. So we're starting a new process here at Children's where we do patient handoff at the bedside. We really want you guys to be a part of this so we can make sure and have as much information about you as possible while you're here. We're going to be doing this handoff between 6:50 and 7:30 in the morning and in the evenings. It should only take about 5 to 10 minutes, but if you're not in the room, we ask that you do come back during this time so that we can complete report. Also, if you're asleep, would you like to be woken up to participate?
That don't sound like anything I'm interested in.
Okay, if there's other visitors present, are you okay with us doing the bedside shift report in front of them?
Okay.
Okay. Let me just say that this is the best opportunity for you to be involved in your child's care. Also, it gives us a good time to discuss goals before the team rounds. If you're not interested in it, we totally understand, but also understand that we will still be coming in to do bedside shift report at the bedside.
Okay. That would be okay. You can wake me, but don't wake my child.
Okay, as always, we will do our best not to disturb her while she's asleep. Let me also say that if you guys need any supplies, we ask that you ask for them before or after shift report. We have to do this on multiple patients in a very short amount of time. Is that okay with you guys?
That's okay.
Okay, well, thank you for allowing us to provide the safest care possible for your child.
Okay, thank you.
Hey, Miss Abby. Miss Abby, hey, can I get you anything? I'm doing my final assessments. Can I get you anything before we do shift report?
Yes, you can get me a Mountain Dew, please.
Okay. And Sydney, hey, are you in any pain right now?
Yes, I have a headache.
Okay. On a scale of 1 to 5, 5 being the worst, what would you rate your pain?
2 out of 5.
A 2? Okay. Let me look and see if you can have some Tylenol, okay? Okay, it looks like you can have some Tylenol, so I'll bring that back in a Mountain Dew. Anything else that you guys need?
No, thanks.
Okay.
The next example will demonstrate how to handle sensitive information prior to entering the room while still completing an effective bedside shift report.
So before we go in, I just want to talk to you about a couple concerns. Parents are separated, so they come during different time frames. She also got a CT yesterday. Mom's kind of concerned about the results, but I told her we would discuss it during team rounds.
Okay.
So we can go in the room now.
Now let's watch an effective and efficient bedside shift report. Be sure to notice the flow of the report, highlighting the information sharing of the patient's dosing weight, central line assessment, and verification of fluids being administered with EMAR order. Look for the review of last medications given and next medication administration times. Also notice how the nurse handles the needs of the parent while giving the bedside shift report. The nurse is assertive and sets a clear expectation for the parent.
Hey, Miss Abby and Sydney. Hey, I'm here to give a report to your next nurse. This is Al.
It is early in the morning. You're gonna wake my child. What are you doing?
Do you remember when we talked about the bedside shift report, you agreed to be a part of it around 6:50 in the morning?
Oh yeah, I had forgot. I do want to participate, but I need to get back to sleep as soon as possible.
Okay. Well, this is your day shift nurse, Al.
Okay.
Good morning, Miss Abby. I'm Al. I'm going to be your nurse for the day.
Hello, Al.
Okay. Just looking at her EMR.
Okay.
So this is Miss Sydney Smith. She has an armband on.
Okay.
Her birthday is 4/5/2005. Her MR number is 6389058.
Okay.
So as you can see right here on her drugs sheet, she is 50 kilograms.
Right.
And then also right up here. So she is our 13-year-old that came in with some pneumonia pretty much 2 weeks ago. She started with cough, shortness of breath. She spiked a temp. And then she also had a low-grade temp last night of 100.8, as you can see. Her vital signs have been good. Other than that, she is on a liter of oxygen. Yep. So neuro-wise, she's appropriate for her age. CV, she does have a left arm pick. Her dressing should be dry and intact. Looks nice.
Okay.
The next time that it's due is on Monday, along with her caps.
Okay.
So she has D5 half with 20 of KCL running at 85. And then also right here on her EMR.
Okay.
There. I told you about the temperature of 100.8. Respiratory wise, she doesn't have any work or breathing. She is on that liter of oxygen. It's at 92 to 94%. She got her albuterol treatment last at 4 a.m. as well as her chest PT. GIGU, her belly is soft, flat, no pain. She has a regular diet, but she's not eating very good, which is why she's on the fluids.
Right. Okay.
Skin skeletal, all within normal limits, no breakdown. Her lab, so she gets a renal panel every day because she's on the fluids. She also did have a CT last night. Emergency equipment should be set up. So over here we have our ambu bag. It's hooked up, turned all the way up. Then she has the oxygen that you saw. Her suction is set up.
Okay.
And then we looked over the drug sheet. Last but not least, her EMR, so she is getting vancomycin every 6 hours, and the next time that it's due is 8 a.m.
Okay.
She got Motrin last at 3 a.m., and that was for her temp, and that can be given every 6 hours. And then also she got some Tylenol around 6:30. That's every 4 hours.
Okay.
Excuse me. I need to get some towels, and I need to get a Mountain Dew with some ice, please. And if you got cube ice, I would like 3 cubes of ice. If not, just give me a little ice. I don't want all that ice. Okay, thank you.
Okay. I'll be happy to bring those in when I do your vital signs in about an hour.
Okay.
And then so ultimately her goal for the day is to start her vancomycin on time and then get some labs.
Okay. All right. Thank you so much, Taylor, for a fantastic bedside report. Miss Abby, do you have any other questions?
Yes, I would like to make sure that she gets her incentive spirometer completed as ordered, and I would like to see the doctor for her CT scan this morning.
So the doctor will be in this morning when they do family-centered rounds.
Okay.
I like the goals that you have. I'm just going to come over here and update my whiteboard, and you and I can review our goals at the same time.
Okay.
All right, Miss Abby, we're going to update our dry erase board, okay, and review our goals for the day. My name is Al, and I'm going to be your nurse for the day. Our goals are going to be to receive vancomycin, obtain our labs. We're going to do our incentive spirometer 10 times per hour,
Okay.
and we're going to discuss our CT results with the team.
All right, thank you.
Any other goals you'd like to review for the day?
I'm so grateful to participate in this bedside shift reporting.
Aw, thank you for participating.
Okay, you're welcome. And don't forget my drinks, so you go on and get them. Thank you.
Yes, ma'am. I'll be right back when I do your vital signs.
Okay, thank you.
All of us at Children's are committed to safety, every patient, every time. Bedside Shift Report will help us meet this goal. If you have any questions or concerns, please contact your unit educator or director. Thank you for your commitment to creating a safe culture at Children's of Alabama.
Okay, so I have a handout on therapeutic communication. If we don't have class tonight, I'll upload it and I'll put it right up here, okay? It's really good because it's based on the NCLEX RN. It talks about assessing verbal and nonverbal clients' needs, like grimacing and things like that. Level of development and age. You may have pediatric patient, so that's important. Level of consciousness, which is important. And it goes on to talk about a lot of great things. If we were in class, I'm going to go over it in detail. So we're going to do a little bit of an assignment. Use that handout. Also, in your Think Like a Nurse, you might want to use that as well. And then I printed something from the Institute of Healthcare for Improvement. Again, if we don't have class, I will upload this. It's about your S-bar. And with this, on the very last page, is a template. Let's see if I can get in here. Okay, template. Okay? I was going to have you work in groups, but you can do this on your own. And you're going to practice doing an S-bar. Okay? I have several examples. So I will read them and you can pick the example you want and you can practice your S-bar. This will be participation. So all I need is this page and just have you, I guess, email it to me. It's kcamp@asumh.edu. So just email this to me or bring it Thursday. How about that? Bring it Thursday. Okay, so here are the four scenarios. Your shift, you have a 55-year-old male with chest pain. He rates it a 5 out of 10. He's had sublingual nitroglycerin 1 every 5 minutes times 3. And he has standing orders to call the MD if it's unrelieved after 3. You have orders for an EKG but no pain medication. His vital signs show blood pressure 150/90, pulse of 101, temp 98.6, and respirations are 20. So, if you pick that scenario, work on your S-bar and see what kind of shift report or situation that you give the practitioner or the doctor. Number 2, you have a male patient with chest pain and shortness of breath. It's been occurring for an hour. He had a fractured femur 2 days ago with surgery and fixation. His vital signs show a heart rate of 118. His blood pressure is 124/62. His respirations are 28. And no orders for pain medications, oxygen, or radiology, or chest x-rays, I guess. So there's your second scenario. Again, you can pick one of 4. I'm not at this point. We're just doing what we can for not having class, and I just want you to do one of them. Third, you have a child with a broken leg. He's in Buck's traction. The aide tells you that he's in pain, especially when she urinates. The urine is malodorous. Vital signs are stable. Temps 101.2. What do you suspect, and what do you do in your S-bar? The last patient's admitted, 18-year-old with weakness and weight loss. He has a history of cystic fibrosis. Heart rate's 80, respiration's 18, blood pressure's 118/78. And he does not like the vanilla shakes that are ordered. What do you do? I want you to practice your therapeutic communication in this as well. And so that's the assignment. I do have a case study, but I'm not going to pose that because we're not meeting. If anyone wants a copy of the model case study, I'll have this Thursday. Okay. Okay, that's all I really have on communication. I did want to go over the video just for likeliness at Baxter. We do have the whiteboards. We do bedside shift reporting in the room. However, we won't be seeing patients until around 7:30 after shift is complete, reports completed, but you guys will still see some of that, and you can still practice that. But that was a really good video talking about bedside shift report. Okay, so now is when we have a dinner break. I've talked for about 40 minutes. I'm sure y'all are bored to tears. I'm going to do another video for collaboration. This was just communication. Thank you.